Have you ever wondered in silence, am I enough? Enough to please her? Enough to feel confident? Enough to stop worrying about size altogether? If that thought has crossed your mind even once, let me tell you that you're not alone. I'm Dr. Sophia Carter, a urologist who has worked with thousands of men. And today, we're going to have a real, respectful, and honest conversation about one of the most misunderstood topics in men's health: penis size and what women really need. Blood flow where you need it. By the end of this video, you'll take away 3 powerful truths. 1. How size really influences satisfaction. 2. What matters to most women much more than length or girth. And 3. How to feel confident in your own skin at any age. Let me start with a story that probably sounds familiar. A few months ago, a patient named Darren came to see me. He had been married for 35 years. He had a loving relationship with his wife, and by all measures, he was a confident and successful man. But he had come across information online that made him question everything about his intimate life. "Dr. Carter," he told me, "I've been reading that the average size is over 15 centimeters, and I've never measured that much. I'm worried I've been disappointing my wife all these years, and she's been too kind to tell me." Darren's story illustrates one of the biggest problems I see in my practice: the gap between what men believe is normal and what really is normal. The medical reality, based on careful measurements of thousands of men, is that the average erect length is just over 13 centimeters. Not 15, not 18, not 20, but 13 centimeters. When I shared this fact with Darren, I saw his shoulders literally relax. But then he asked me the question that really gets to the heart of today's discussion. "But doctor, what do women really want? What do they need to be satisfied?" This question led me to dive deeper into the research. And what I discovered was both surprising and reassuring. The gap between what men think women want and what women actually report wanting is enormous. Most men assume that women prefer sizes much larger than they actually do. And most men have no idea how satisfied women already are with their partners. This is where the research gets really interesting, and where I think you'll be surprised by what women have actually told researchers when asked directly about their preferences and satisfaction levels. In one of the most comprehensive studies ever conducted on this topic, the researchers used a unique approach. Instead of asking women to recall or imagine different sizes, they created life-sized, 3-dimensional models that women could actually handle and examine. When asked to select their ideal size for a long-term partner, the average woman chose something that measured 16 centimeters in length. Now, you might think, well, that's still bigger than average, and you'd be technically right. But here's the crucial detail. 20% of the women in the study chose not to report any size preference at all. That means 1 in 5 women essentially said, "This doesn't matter enough to me to even have an opinion about it." But the most revealing finding wasn't about preferences. It was about satisfaction. When the researchers surveyed women about their real relationships, 85% reported being satisfied with their partner's size. 85%. Meanwhile, when they asked men about their satisfaction with their own bodies, only 55% said they were satisfied. Think about that for a moment. There's a 30% gap between how satisfied women are with their partners and how satisfied men are with themselves. This means millions of men are worrying unnecessarily about something that isn't actually a problem for their partners. I see this disconnect every day in my practice. Men come in convinced they need to change something about themselves, while their partners are at home wondering why their husband or boyfriend has suddenly become distant or shy about intimacy. From a medical point of view, let me give you some perspective on what we really consider concerning versus what's completely normal. As a urologist, I've examined thousands of men, And I can tell you with absolute certainty that the range of normal is much wider than most people realize. The medical definition of what we call micropenis, the only size-related condition that truly requires treatment, applies to less than 1% of the population. We're talking about measurements of less than 7.5 centimeters when fully erect. Anything above that falls within the normal range, even if it's on the smaller side of normal. What fascinates me is how many men come to my office seeking treatment for what they perceive as a problem, when, from a medical perspective, there's absolutely nothing wrong. I've had patients who measure perfectly average, asking about surgery or treatments. This is where I share something that might surprise you. In my years of practice, I've spoken with countless couples, and I've never had a woman complain that her partner's size is too small, assuming it falls within the normal range. However, I have had women express concern about partners who were exceptionally large because it caused discomfort or made intimacy difficult. The human body is designed for compatibility. Women's anatomy is remarkably adaptable, but there are limits in both directions. Being significantly larger than average can actually create problems, while being average or slightly below average rarely does. This brings me to what I consider the most important part of our conversation today. If size isn't the determining factor in satisfaction that many men believe it is, then what really matters? What creates the kind of intimate connection that leads to mutual satisfaction and lasting happiness? After more than 10 years of listening to couples discuss their intimate lives, I can tell you that communication consistently emerges as the most important factor. The couples who are most satisfied with their intimate relationships are those who can talk openly about their desires, concerns, and needs. Think of it this way. Intimacy isn't a performance where one person does something to another. It's a collaboration where two people work together to create something beautiful. And like any collaboration, it requires communication, patience, and mutual attention to what works for both people involved. I remember a couple who came to see me together, something that doesn't happen often, but when it does, it's usually very revealing. The husband was convinced he wasn't physically satisfying his wife and had become so anxious about it that their intimate life had practically stopped. When I asked his wife directly about her concerns, she looked genuinely puzzled. "I don't understand why he thinks there's a problem," she said. "Our intimate life was wonderful until he started worrying about this. The only problem I have is that he seems so stressed and distant now that we barely connect at all." This story illustrates something I see repeatedly. When men obsess over physical measurements or performance, they often stop being present with their partners. They focus so much on what they think they should be doing that they stop paying attention to what their partner really wants and needs. Women consistently tell researchers that emotional connection, feeling desired and appreciated, and having a partner who pays attention to their pleasure are much more important than any physical characteristic. The most satisfied couples are those where both partners feel heard, valued, and prioritized. Now, speaking to many of you who might be in your 50s, 60s, or beyond, let me address something that becomes increasingly important as we age. Our understanding of intimacy and satisfaction naturally evolves over time. I've noticed something wonderful in my practice. Couples who have been together for decades often have the most satisfying intimate lives. Not in spite of their age, but because of the wisdom and understanding they've developed over the years. They've learned that intimacy isn't about performing to some external standard. It's about connecting with the person you love. As we age, our bodies change in many ways. Hormone levels shift, response times may slow down, and what once felt effortless might require more patience and creativity. But these changes don't have to mean less satisfaction. In fact, many of my older patients report that their intimate lives became more satisfying as they learned to focus on quality over quantity, on emotional connection over physical performance. There's something liberating about reaching a stage in life where you realize that the movies, magazines, and online content that shaped your early understanding of intimacy were selling you a fantasy, not reality. Real intimacy, the kind that sustains happy marriages for 40 or 50 years, looks nothing like what you see in popular culture. The men who adapt best to aging are those who understand that being a good partner has always been more about attentiveness, affection, and emotional availability than about physical characteristics they can't control. These men often find that their relationships deepen and become more satisfying as they let go of unrealistic expectations and focus on what really matters to their partners. I've had patients tell me that some of the most meaningful and intimate moments of their lives happened in their 70s and 80s, when they finally stopped worrying about living up to some imaginary standard and started focusing completely on the joy of connecting with someone they love. So, what does all this mean for you, practically speaking? How do you take this information and use it to improve your confidence and relationships? Let me share some specific strategies that I've seen work in my practice. First, understand that confidence is far more attractive and satisfying to partners than any physical characteristic. When you feel good about yourself and approach intimacy with joy instead of anxiety, that energy is contagious. Your partner will feel more relaxed and open, creating a positive cycle that benefits everyone involved. If you've been avoiding intimacy due to insecurity about your body, consider that your withdrawal might be causing more problems in your relationship than anything you're worried about. Most partners would rather have an enthusiastic and attentive lover who feels average about their body than a distant and anxious partner who happens to be physically exceptional. Communication is something you can improve starting today. Instead of assuming you know what your partner wants or needs, ask. And not just once. Make it an ongoing conversation. What feels good? What would you like more of? How can I help you feel more connected to me? These aren't embarrassing questions. They're the foundation of great intimate relationships. Take care of your overall health because that affects every aspect of your intimate life, much more than size ever will. Exercise regularly, eat well, manage stress, get enough sleep, and address any medical conditions that might be affecting your energy or confidence. A healthy body functions better, feels better, and gives you the stamina and enthusiasm to be fully present with your partner. Focus on giving pleasure rather than on your own performance or appearance. When you shift your attention to your partner's experience and satisfaction, several wonderful things happen. You become more attentive and skilled. Your partner feels cherished and prioritized. And, ironically, you often find that your own satisfaction increases when you stop worrying so much about it. Let me speak briefly about when it makes sense to seek professional help, whether medical or psychological, because there are times when external support can make a real difference in your quality of life and relationships. From a medical standpoint, if you're experiencing changes in function, difficulty achieving or maintaining erections, diminished sensation, pain during intimacy, or any other physical symptoms, it's worth discussing them with a healthcare provider. Many of these issues have straightforward treatments, and addressing them can significantly improve your confidence and satisfaction. If you find that anxiety about your body or performance is affecting your relationships or quality of life, consider talking to a counselor who specializes in intimacy and relationships. This isn't a sign of weakness or failure. It's a sign of wisdom. Just as you'd see a doctor for a physical health issue, it makes sense to get professional help for emotional or relational concerns. Couples therapy can be particularly helpful if you and your partner seem to be struggling with communication or if there's tension around intimacy. A skilled therapist can help both of you express your needs and concerns in a safe environment and develop strategies to connect more effectively. The key is recognizing that seeking help is a sign that you care about your relationship and your own well-being. The most satisfied couples I know are those who address issues early and directly, rather than waiting for them to resolve themselves. As we wrap up our conversation today, I want to leave you with the most important message from everything I've shared. You are enough, exactly as you are. The anxiety and doubt that so many men carry about their bodies is based on myths, not medical reality. The research is clear, the medical evidence is overwhelming, and my experience with thousands of patients confirms it. Satisfaction in intimate relationships depends far more on emotional connection, communication, and mutual care than on any physical measurement. Your partner fell in love with you, chose to be with you, and continues to choose you every day for reasons that have nothing to do with numbers on a tape measure. Focus on being the kind of partner who's present, attentive, and affectionate. Invest in your health, your communication skills, and your emotional availability. If today's conversation has helped you feel more confident or given you a new perspective on your relationships, I hope you'll share this information with other men who could benefit from it. Too many good men are suffering unnecessarily from insecurities that have no basis in reality. Remember, the goal isn't perfection, it's connection. It's not about living up to some impossible standard. It's about showing up fully for the person you love, and you're already equipped with everything you need to do that. Thank you for trusting me with this important conversation. Until next time, take care and remember, you matter.